Article 13, Section 11 of the 1987 Philippine Constitution, in no uncertain terms, lays down the national health policy of our country in this manner. The state shall adopt an integrated and comprehensive approach to health development, which shall endeavor to make essential goods, health, and other social services available to all the people at affordable cost. Section 12 states that the state shall establish and maintain an effective food and drug regulatory system and undertake appropriate health, manpower development, and research responsive to the country's health needs and problems. Section 13 states that the state shall establish a special agency for disabled persons for their rehabilitation, self-development, and self-reliance, and their integration into the mainstream of society.
Liver cancer, or hepatocellular carcinoma, is the growth and spread of unhealthy cells in the liver. Cancer that starts in the liver is called primary liver cancer, while cancer that spreads from the liver to other organs is called metastatic liver cancer. Liver cancer is more prevalent in the Philippines compared to other countries, ranked as the 8th most common cancer around the globe. According to the Hepatology Society of the Philippines, liver cancer ranks number 2 among all other killer cancers in the Philippines. Data from the Department of Health likewise that it is the 2nd most prevalent cancer among men and the 9th among females in the country. Nowadays, we see that more and more Filipinos are being diagnosed with liver diseases, yet it is still considered to be a silent epidemic. Liver cancer is relatively common in our country, primarily because many Filipinos suffer from liver cirrhosis. Cirrhosis precedes 80% of all liver cancers. The usual cause among Filipinos is chronic hepatitis B, hepatitis C, infection, tobacco and cigarette smoking, and alcohol consumption. The incidences of liver cirrhosis and hepatocellular carcinoma led to studies regarding alcohol consumption and its detrimental effects.
Recognizing the prevalence of alcohol consumption in the Philippines, Republic Act No. 6956 was signed. This is an act modifying the excise tax on distilled spirits, wines, fermented liquor, and cigarettes, amending for the purpose of Sections 138A and B, 139, 140, and 142C and D of the National Internal Revenue Code as amended. Increasing the excise tax is the best buy and win-win intervention for reducing alcohol consumption, increasing the revenue for health, building on the public impact of RA 10351. Presidential Decree No. 1619 was also passed. This decree penalizes the use or possession or the unauthorized sale to minors of volatile substances for the purpose of inducing the intoxication or in any manner changing, distorting, or disturbing the auditory, visual, or mental process. President Duterte approved the proposal of increasing excise taxes on alcohol and tobacco products backed by the Department of Health and the Department of Finance during the 33rd Cabinet meeting. As Panelo said, this is a key public health measure to reduce deaths and disabilities due to tobacco and alcohol consumption, and at the same time, a revenue measure to fund the Universal Healthcare Program.
Lack of access to affordable healthcare services and obstinacy among Filipinos make it more difficult to detect the condition early and provide intervention for liver diseases. Most liver cancer patients die within a year of diagnosis, and the 5-year survival rate for the disease is less than 5%. Even with treatment, the 5-year survival rate for liver cancer is still low, 35%. The outlook for liver cancer is poor, but the disease is preventable because the major risk factors for the disease have already been identified. Measures that can significantly reduce one's risk for cancer of the liver include vaccination for hepatitis B, screening and treatment for hepatitis C, avoidance of high-risk behavior, avoidance of alcohol and tobacco consumption, proper diet and exercise, and proper storage of foodstuff.